All right. Again, thank you to all the providers and families and folks coming out to just give us some information around monkeypox and sickle cell. So I just want to thank Dr. Makala, Dr. Bell, and Dr. Fairtrend for being willing to come on. I'm really going to hand it off to you. Sorry. I'm going to hand it off to you to really just take it from here. And then I think if you give a little bit of information, and then just let us, some folks have some questions that I'm sure they will want to ask, and then we'll go from there.
All right. Well, I guess I'll start off. My name is Martin Makala. I am an emergency physician. I work both at Mon Lake and at Harborview, and we are seeing patients with monkeypox. And so when Foxy asked us to speak, I thought this was a really good opportunity to be able to settle some rumors and some thoughts about this new disease. It seems to me like we've been looking at a new disease now for several years, and how does it affect sickle cell? And I think the good news for this one is that this disease doesn't affect sickle cell specifically. We can't find any evidence in the medical literature, nor have we seen personally, that monkeypox is any more of a risk for people with sickle cell disease than it is for anyone else. So, in one sense, that's really good. In the other sense, it's still a bad disease. And I'd like to talk a little bit about just the disease in general, just so you have some idea why we think it's so much less concerning for people than COVID. It really, that comes down to the method of transmission. And I need to be a little bit blunt, a little graphic, just to talk about that monkeypox, at least right now, is essentially a sexually transmitted disease. It is more common in the population than it has ever been. That's the outbreak that we're seeing. But this is a disease that is passed by human fluid and human mucosal surfaces like mouths and lips. And that is the difference, because short of that type of activity, you really can't get this disease. So this is not something where we're so worried about being 6 feet away from someone. Being any feet away from someone is good enough. A casual handshake is not how you get this disease. Being close to someone, speaking with them, singing in the choir with them, those type of things that we were so worried about with COVID, that just isn't a concern that we have for monkeypox. So that's really good news. There are people who are at higher risk, but those are people who have more sexual activity than others, especially sex between men, very frequent sexual partners, recent sexually transmitted illnesses. These are the people who are getting this disease currently. This is very similar to how HIV started, and that has caused its own challenges. But we want to make sure that for now, at the very least, that people know that short of those type of activities, we're not seeing any increase in risk. And again, certainly not seeing any increase in risk in sickle cell patients particularly. With that, I will stop for a minute and let my colleagues mention some other things that we want you to know, and we'll go from there.
All right, I think I'll go next then. My name is Kleber Fertran. I'm the hematologist in charge of the sickle cell disease program at the Fred Hutchinson Cancer Center. I agree with what Dr. Makala just said. I think we haven't seen significant overlap or any overlap at all between sickle cell disease and monkeypox. Of course, it might happen, as like with any other random infection. Any person could potentially at some point get monkeypox. And if you do happen to have sickle cell disease, my concern is that if that really happens, since it does cause fevers, it does cause those skin lesions that people have been looking at, I would expect the patient to maybe get a crisis if they have this disease. So of course we want to be vigilant, but there is really no reason to believe that sickle cell disease patients would be more likely to get it, or that monkeypox would be particularly worse. I think the exception I can think of is whether one of those skin lesions gets infected, because of course any infection in sickle cell disease patients is expected to be more severe. But other than that, the virus itself and the disease itself is not expected to be any more concerning than in patients with any other chronic condition. About I think what we can do to prevent, and I think we can go back to that depending on what questions people have. But of course, you guys have heard about vaccination, and as of this very moment, the CDC is not recommending we vaccinate patients with sickle cell disease. It's more the vaccination for people who have been exposed to someone with a confirmed diagnosis of monkeypox. The other thing that I need to add on top of what Martin mentioned is that not only is this disease less contagious, but also it takes a while to incubate. So we have a window of opportunity of 14 days to vaccinate someone after they've been exposed to someone who actually had a diagnosis. So those are the people that preferentially need to get a vaccine. And then people who work in labs dealing with human samples that are being investigated for monkeypox. And finally, it's more, I think people have said in several meetings I've been in the past few weeks, it's more about what you do than what diseases you have or who you are. So at this very moment, having multiple sexual partners, particularly men who have sex with men, but not necessarily, but I think as we mentioned, the same thing happened to the HIV pandemic. So even though at this very moment that's how it stands, we know there's no reason for this disease to prefer any particular population. It's just the way it's happening right now. And last but not least, before we started this meeting, I mentioned that, of course, we worry about our patients in terms of the fact that monkeypox is endemic in certain regions of Western Africa. So we know that there is always the chance that someone is traveling to Africa or has family member, friends, whoever coming from Africa. This is not how we expect monkeypox to spread. We don't the way the virus that we have at this moment circulating in our population, even though it did originate in Africa, we don't expect newer cases to keep coming in just because people are traveling back and forth. It's definitely a possibility, but it's not the main way that we think monkeypox is going to reach our population right now. I think, and the vaccination I mentioned, we can talk in more detail if necessary, but it's only approved for adults, so people age 18 and over, which is why I'm going to pass it on now to Dr. Bell, who is a pediatrician and can talk more about what we should worry about in children.
Hi, everyone. It's so good to see you all. Shaquita Bell. I've been at many a task force meetings. You're probably sick of hearing my voice, but here I am again. I'm sad to come for another infectious disease reason, but I'm happy to be here to support and answer any questions. The biggest things I want to continue to share, like my colleagues have, is one, having sickle cell disease does not put you at increased risk of acquiring monkeypox or having a negative outcome necessarily from monkeypox. Two, the vaccine is only approved for people 18 and over. So places like Odessa Brown, we do not have the vaccine right now. Harborview and UW does have some vaccine supply. It's very, very limited. Seattle Children's is looking at trying to get the vaccine, but again, it's only approved over the age of 18. And then two, to say that there has been very few cases in children in the state of Washington, and there's very few cases across the country in children. It's not impossible, it's just not very common. We believe the primary way to get monkeypox for a child is to come into direct contact with a sore. We do think that masks are offering some additional protection. So masks, hand hygiene, again, something we already are very familiar with COVID, is also protective for pox viruses. So we do recommend that. If you are at all concerned that one of your children or somebody in your family who's under the age of 18 may have monkeypox, we are directing all calls to the Seattle Children's ER, where they have a special screening process for monkeypox. We can do a telehealth visit as well to try to assess the risk, especially if you're just not sure. So there's a lot of options. You should not be concerned about calling your doctor's office. You definitely should feel free to reach out. We're certainly happy to talk and happy to triage, but the news for kids, much like the news for COVID, is pretty good. So I think we'll pause there, and Foxy and the rest of the team will open it up for questions. Hi, Ken. Good to see you. We're matching today. Nice color.
I missed the memo.
Awesome. Thank you so much for this information. And now it's going to open it up. If anyone has questions, concerns, any other thoughts you want to ask, you can feel free to ask any of the docs. Any questions?
I do have a few questions. My name is Anjali, and there's a couple of terms that I'm hearing being used with monkeypox. I'm hearing disease, and then I'm also hearing virus. So I'm wondering, is this a virus or is it a disease? And I know, like with HIV, the HIV component is viral, and then you can end up with the acquired immune deficiency syndrome, which is more of the disease. So I'm wondering if monkeypox is the same. And with the vaccine, is that curative? Or because I'm understanding that the vaccine would be utilized if someone thinks they've been exposed or knows that they've been exposed. So I'm just curious to know if it's curative, or kind of what the role of the vaccine is. And then I just want to clarify that for those in the pediatric realm, if you're seeing it, it's a child that's had exposure to an open sore or a lesion. So they've had direct contact with someone who's got an outbreak of the symptoms with monkeypox. And I'm wondering if you guys don't mind sharing what monkeypox, how it is presenting itself. And I understand that it doesn't seem to be presenting itself more severely in persons with sickle than without, but I'm just wondering, what that would look like, just in general, and then what is the outlook for monkeypox in our region? Is it something that, I know right now the numbers are low? Is it projected to increase? Kind of what does the timeline look for that? And I know that's a lot, but I just, had a lot of questions.
Maybe I can take the peds one, and then Clever, I think you could answer a couple of them with your slides. So the peds one is correct. We have had very few pediatric cases across the country. I want to stress, one is enough. If it's your child, that's too many, but it is not common in children. It's very uncommon. And so far they have been able to trace direct contact. So we believe that the children who have acquired monkeypox have gotten it from direct contact with open sores. We still think that the best way to protect, though, is through hand hygiene and masking. But if you have a case in your household, or you believe you had contact, that's exactly why we want you to call in. And then your question about the vaccine being therapeutic or preventative, it's actually both. So we want to vaccinate people who are at high risk of being exposed, who may have been exposed. So say somebody in your household tests positive, you don't have any symptoms, they still want to vaccinate you. And there is some emergency use authorization coming for children who are in households where monkeypox has been diagnosed. And then if you do have symptoms that are consistent with monkeypox, there is a belief that giving you the vaccine at that point could also be helpful in shortening the course. The only other thing I'll throw out is that I know that it's caused by a virus. I don't know where the name disease comes in. So maybe, Clever, that's a good chance for me to pass the buck on that one. It's a great question.
Yeah, great question. And I think you got the idea right. Monkeypox is the name of the virus. And I'll just take the opportunity to say that as far as I know, it was named because it wasn't identified in lab monkeys, but it's actually not. You don't find it in nature. Let's say in Western Africa, as I was saying earlier, you will find it more in rodents. So rats and mice are more likely to be reservoirs for this virus and keep it existing in the world rather than monkeys, because monkeys actually get sick in a similar way that humans do. But in any case, monkeypox virus is the name of the virus. And then we are saying monkeypox as to say, oh, whoever has the disease, so manifests the symptoms. So I think that's why we're using the same word, but I guess maybe the virus should be called like MPV, monkeypox virus, and the disease could be called monkeypox simply. As far as the manifestations, yeah, I pulled some pictures that the CDC has provided providers just to give examples of how the lesions look like. So I know it's kind of dinner time, but they're not too graphic. So I hope you guys can see this. And yeah, I'll make it bigger. Okay. So they can be, they have a range of types of skin lesions. So they might be very small and only like reddish with some swelling around it. But the more typical and more, I'd say, mature lesions are those pustules. They look like they have like some secretion, some fluid inside, and eventually that pustule will rupture, and you will get scabs on the lesions. So you can see that there's a wide range of skin lesions that people with infection by the monkeypox virus can have, because they will the skin lesions will follow a certain sequence from just redness until they get that blister, and then the blister ruptures, you get the scab, and when the scab is off and the skin is whole again, that's when the disease is officially over. I think most importantly is that we recognize that people do not transmit the virus before they have any symptoms, and they cease transmitting the virus once the skin lesions have shed the scab and there's nothing open. So again, I think to what Dr. Bell was saying, the way I can envision a child catching monkeypox would be maybe from an adult at home, someone really close who has like open lesions, and then they're like constantly in close contact with those open lesions, and that would be a higher risk of real transmission. But otherwise, again, it's not something that I would expect anyone to catch while using public transportation, for example, or something like that.
One thing we've found in the emergency department is, unlike many other lesions, once the scab has formed, most other lesions are no longer contagious. But with monkeypox, even the scab still is contagious. So it's not until the scab has come off on its own and there's real skin growth over the top that it's really over. That is a little bit different than some of the other lesion forming viruses that we have.
Yeah, I guess the parallel is with chickenpox, right? In chickenpox, when you have the scabs, you're not transmitting anymore.
Yeah, so that's been a little bit of a challenge for us in the emergency department. We've seen some people with that, and that may be part of where the pediatric exposures come from, when people think that they're no longer contagious, but actually they still are. It's hard to know.
Martin, do you mind sharing? I know the answer, but you're doing it a lot more often than I am. Do you mind letting us know what the testing is like? Like, what is the test for monkeypox involve, and how long does it take to come back?
Yeah, the good news is the test is very simple. It's nothing but a Q-tip rubbed on the lesion and sent to the laboratory. We usually have those back within 24 hours. Again, much like COVID, things will get faster as we need to have more fast diagnosis, but it is not an immediate test where you come into your doctor's office and get it back in minutes, like a blood sugar test or something like that. So it's a next day type of test, but it is absolutely painless and very simple to perform. There's no magic in obtaining the sample.
And I think it's a good moment to highlight that if you, for some reason, think you might have, or someone in your family, anyone might have monkeypox, it is okay to go to. You should see someone, and I think what's most important is to avoid contact, right? So you want, for example, of course, you're looking at a rash, so cover the rash while you are going to the hospital, to the clinic to be seen, that will help a lot not spreading it. Because again, it's not like you're going to rub onto someone and transmit it. But if you keep the rash covered, you can block the transmission that way as well.
Yeah, I would share that, and we're passing that on in the emergency department as well. That unlike COVID, where we said unless you're sick, stay home. We want to see these early. Anybody with lesions, they should cover them and come in and have them evaluated and tested so that we can stop things, because we have a very good treatment if it's positive. So it's a little bit different attitude than we had for COVID. The numbers are also small for now, so we can handle this disease in clinics, and because it's not so contagious, we don't have to close clinics down. So all the access is much, much better. I would ask that you don't come to the emergency department unless you're sick, but coming to anywhere that you can be tested and talk to a provider about how to be evaluated is the right thing. And if you can't get anywhere else but the emergency department, or you're not feeling right, or you're just too darn scared, then come and see us in the emergency department. But this is a disease that can be handled at a primary care office or an urgent care, so that someone can look at the lesion and get the test going and figure out how to get a vaccine if necessary.
Just a question in light of that, I'm going to ask two questions, but the first one, I also know, I just hearing what you guys were speaking to before we started, just the capacity issue at the ERs right now. If someone did show up, would they really be serviced in the ER? Right. Just being very, very realistic, or should it be something that you go to urgent care for at this point, or just like go the next day to your doctor?
Uh-oh, you're muted, Martin.
Thanks. You think after 3 years I'd know how to do this?
We're all in the same boat.
Tell you, Foxy, anybody who comes to the emergency department will be seen, and for any reason. We don't judge up front to say you shouldn't be here. We bring people back and we perform the evaluation. Now, because things are so bad and we're so backed up, then that means if you don't look very sick and you aren't very sick right now, you're going to wait until we can get to you, and that may be hours. So that's the piece of, if you can get care somewhere else, that makes more sense. If you can call your doctor and be seen today or the next day, that makes a lot more sense than sitting in a crowded waiting room in the emergency department being miserable for several hours. So yes, you would be seen. If you can go somewhere else, you should. And again, if you're sick, you should come to the emergency department. If you're not feeling right, that's not part of this disease. And so we need to figure out something else. We need to figure out why you're not feeling well. That's a little bit different issue than I have a lesion on my hand that I'm worried about. So I guess that's where I would leave that.
Okay, thanks so
Yeah,
much.
and just to clarify, Foxy, for pediatrics, I mean, Harborview covers everything, but for Seattle Children's, we are screening over phone and telehealth, and then they are requesting us to send kids to Seattle Children's ER, and they are doing a rapid swab process where they are seeing kids for monkeypox screening. So for instance, if you had called me and said, hey, my kid wants or may have been exposed or has this rash, I do a telehealth visit with you or a phone call with you, we agree, then I call the ER and send you in, and they meet you in the parking lot. So that's the plan right now. That may evolve as we're able to get tests in pediatric sites. Like Martin said, it's actually really easy to test. It's more of a process of getting that test from our clinic to the place that can run it at this point. But that's the current plan at Children's, and they have dedicated staff just to monkeypox screening. Fortunately, again, not super common in children, so it's not a big lift at the moment. As I think you're hearing, if this evolves the way COVID does, which we do not expect that because it is not nearly as contagious, but if it does, we may have to come up with different processes. But that's the process for right now.
Awesome. Thank you. Second question. I know some of y'all are in here doing this too. You looking at everything on you like, is this a lesion? Is this possibly? So can any of you, I know none of you are, therapists, psych, but just speak to the fact of, we're in still the virus of COVID, and then monkeypox shows up. If you needed help in just anxiety and just feeling overwhelmed, where might folks go in your facilities?
So I'll start by saying at our clinic, we have our wonderful social worker, Angela, and all patients can reach out to her. She is excellent. She can definitely relate to all these things that we're going through. It doesn't need to be about monkeypox. Of course, monkeypox is not helping anyone's mental health at this moment, but we do have her as our main resource. And she's readily available most days. We can set up appointments. She can call patients. It's phone calls, telehealth, in-person visits, whatever really people need. And sometimes you might be wondering, like, oh, I don't know if I really need like specialized care. And I don't know that anyone can really know on their own. I think it just helps to talk to someone, share what you're feeling and what's going through your head, and then and that's what she does best, and just give some advice as to maybe how you can try to handle it on your own if it's not like serious business. Give you some strategies, some just ways to cope with the current situation. But of course, whenever we spot something that sounds more concerning, we also have our whole psychosocial department. They have psychologists, psychiatrists to escalate that if you're in need for more help. But overall, I think there's always, and even us as providers, like if you're even unsure that you need to talk to a social worker or anyone in the mental health department, it's fine. We can always help you figure that out. But I've never regretted having any patient talk to our team.
Here's a little morsel for Wednesday's meeting. I will be there and I'll be introducing the many new folks who are on our team for sickle cell and pediatrics. So we have many new team members, including a care coordinator, a social worker, and some administrative help. And so much like Kleber was just speaking to, our social worker, London, would be happy to take calls and talk about mental health and opportunities to connect to resources. We also do have a dedicated psychologist for our families, our patients with sickle cell, and his name is Chris McCormick. I'll be showing his picture so you can see him, but he still has openings same day, so he's always happy to see folks. And then frankly, we're doing a ton of triaging on phone and pictures. Like if you want to send a picture in, I've got this thing, I don't know what it is. I can't tell you how many. I mean, just today alone, I've probably looked at 12 different skin things. None of them were monkeypox, fortunately. And we do have a dedicated dermatologist who's also on backup. So, and I did talk to him once today. It was a granuloma, not a monkeypox, but looks very similar if you Google that. So yeah, we're happy to help talk about anxiety and really actually try to address anxiety for something that's really real, right? If you find something on your body, you want an answer to that. That's one of the primary ways we can address it in the moment. But then talking about larger picture of dealing with a new infection. Many of you have also heard about the polio cases out east and ongoing COVID. There is a lot to drive up our natural brain chemistry of protecting our body. And sometimes that becomes excessive and leads to worrying and trouble sleeping and trouble with your relationships. And we are here to help and we want to help. So please reach out, especially if your kids are struggling, because they oftentimes don't have the words to ask for help, but you as parents do know a lot more about what's going on than they're willing to talk about sometimes.
Awesome. Thank you for those answers. Very helpful. Any other questions? Please know that some of this, I know some of you came in a little bit late. We will be recording this and we'll get it up hopefully by tomorrow so you can review this video. But if you have any last minute questions for our guests, you're more than welcome to ask now.
Don't be shy.
I think I'll throw in while we're waiting for someone to have the guts for that last question. I think if you have a new lesion, someone should look at that, whether you think it's monkeypox or not. So if you have something that's popped up and you're wondering if it's monkeypox, even if it isn't, it's probably worth having somebody look at to say this is nothing or this is something that you should find out about, because there are other things that matter that pop up on the skin. I guess conversely, I would also say if you've had that bump on your finger since 1978, it's probably not monkeypox, right? Because that would be long gone by now. So if it's even a month old, it's not monkeypox. You don't have to even consider that anymore.
Yeah, it's definitely self-limited. I think that's a good thing to keep in mind. It has to be something that shows up pretty quickly. You said 1978, and I thought of something that people should maybe know about. If you were born in the 70s or earlier than that, there is a chance that you've been vaccinated for smallpox. And if that helps at all with anxiety, there is a chance that people who have been vaccinated for smallpox have some degree of protection against catching monkeypox. I won't say it's perfect. It doesn't mean that people who have been vaccinated and get exposed to monkeypox now wouldn't be vaccinated again. But just if that helps at all with the anxiety of catching this new disease, that's also helpful to know.
All right, y'all. We ain't gonna hold you.
Good, dinner's ready.
Oh,
Food driven. Fine.
Denise over here says, what's your address?
That's a good question.
All right. Well, thank you again so much for simply being willing to come on and share with us some information around monkeypox. We really appreciate it. I just want to say too, I mean, we put an ask out about a week and a half ago, and these guests were willing to show up and be able to give us some information. So really, really grateful, because we know that times right now, people are really busy. Thank you for what you do in all these clinics. And yeah, we'll see you. Hopefully you won't see us. But but we promise that if we're not feeling well, we're coming in. All right.
Great. That's what we want.
Yeah. See you Wednesday.
See you Wednesday. Much respect.
Those two intersect.